everyone, welcome to AnMed Health. I'm Allie Cooper. I'm one of the interns here at AnMed, and so I'm on my pediatrics rotation right now, and I'm going to kind of show you around and let you see what a day in the life of a peds intern is. So follow me. So this is our peds call room. It's in kind of a space where there is a common space in the middle. There's an attending call room or / med student call room, whoever's here. This is the pediatric night float team call room, and then there is an OB call room. So there's a computer space in each room. We have our peds resources over here. The little blue index card is what we use that has all of our standard questions when we admit a baby right after they're born. We also have this wall of resources, which are just quick resources of things that you may need to know quickly. You don't have to look it up. Also has a list of all of the pediatricians in the area so that we know who the baby's going to see after they're discharged. This space is used for night float to get some rest if they can. Also each has a computer for them to use. We also use this computer during the day for whoever's on hospital day or call day. So on peds, you typically rotate depending on how many residents are on the service. Usually there's 2 second-year residents and 2 first-year residents rotating. So one person would be on night float each week, and then every 3rd day you would rotate between clinic day, hospital day, and day call. So everyone gets here early in the morning and sees their patient, and then the day call person would stay all the way until 7:45 p.m. and that's when all the pediatricians sign out to each other, and then the resident team joins in on that and we sign out with them. And then your hospital day person would be here until about 5 p.m. to help the on-call person admit patients, because we see patients that are in the intermediate nursery. We admit babies that are just born from L&D, and then we also admit patients to our peds floor. And so sometimes that can get overwhelming, and it's a good thing to have 2 people here to work on that. And then your person that's on clinic day would be here in the morning, go to morning rounds, and then following that they would go to the family medicine center and see their patients there. This is one of our mom baby rooms. This is where we round on the infants each morning. So our babies here room with their mom unless there's a reason for them to go to the intermediate nursery needing extra care. So both OB and peds teams will round in these rooms every morning. So welcome to our intermediate nursery. This is where we care for babies that need a little extra attention. We've got an isolette here, so we do temperature control with that, making sure that their temperatures are where they need to be at room temperature before they leave. We can also do phototherapy. We can do NG tube feedings. We can stabilize babies and intubate them for transfer to tertiary care. And we can also do withdrawal treatment for babies that are needing that as well, monitoring their scores and administering medication as needed. So right now we're really busy in the intermediate nursery, and this experience is really great. It's kind of beyond what we need to know for family medicine, but I really enjoyed it. It's been a challenge along the way, and calculating all the fluids and the feeding needs for these babies gets really intense. So it's a great experience. So this is our rounding room. We do common rounds each morning, which consist of all of our peds residents, our OB residents, which are all family medicine residents, but the peds team, the OB team. We have the night pediatric attending, which is a pediatrician, and then we have our family medicine attending that's attending for OB that day. Also have several medical students, and so in addition to using this space for common rounds and to talk about mom and to talk about babies, so both teams are aware, we also have all these awesome mannequins. This in particular is the peds mannequin. It's a little baby. We can do intubations on this mannequin. It has an umbilical cord where you can practice drawing blood from it. You can also practice IO lines in the leg. So in addition to having peds mannequins, we also have an OB mannequin that delivers, you can practice delivering a baby, practice some shoulder dystocia. So this space is a learning space we use every day, but then we also come back up here to do some extra learning in the meantime. Hey everyone, this is one of our peds rooms here at AnMed. We usually take kind of bread and butter peds cases, so your asthma exacerbations, viral infections, failure to thrive, croup, bronchiolitis. We can do high flow oxygen and heliox therapy. There's also an opportunity for lots of procedures, including lumbar punctures. And we also have some specialists that can come here and see patients if we need a consult as well. So this is our cafeteria here at North Campus. We have lots of different stations and food options. There's a chef's prep station, which is kind of the specific special item for each day. Some of our favorites here are the shrimp and grits and the Asian hibachi line. They also have a sandwich line every day, as well as a salad bar, which you can choose what goes into your salad. We get a stipend, which is largest during intern year for our meals while we're working. That's just because as interns, we have the most inpatient hours. We have gotten some extra money added to our stipend amount during COVID time so that we can make sure that we're well fed while we're here all of our long hours at the hospital. So we're finishing up our tour here in the doctor's lounge. As you can tell, there's plenty of snacks. So if you don't get enough to eat, all the snacks in here are free game, free for you to get. There's also sodas, there's a coffee machine, also some other like breakfast items, granola bars, Pop-Tarts, those kind of things. So thanks for joining me on the tour of the peds wards and our year as an intern on peds. Also on a side note, I'm not wearing a white coat because on peds sometimes that scares the kids and they have a lot of anxiety from that. So that's why I'm not wearing a white coat here, but thanks for your interest in AnMed and we hope to see you soon. So thanks for watching our video. If you're interested and would like more information on our program, you can contact Lee Freeman and she'll get you in contact with the right person to best answer your questions. Thanks.